Daybreak
In the morning.
with Vivek Sanil and Muriel Desar. Talk 100.3.
8:36 on the clock. Vivek और Muriel आपके साथ हैं. And joining us today this morning is Dr. Khaldoun with us, now a thoracic surgeon. We'll speak to him about chest cavity, the complications that arise over there. Dr. Khaldoun, a pleasure to speak to you. Good morning.
Good morning.
Good morning. My pleasure to be with you on air.
Absolutely. Sir, you are a thoracic surgeon. If you could explain to our listeners how to deal with complications of the chest cavity in people?
Okay. First of all, a lot of confusion about thoracic surgery. What is it? So thoracic surgery is different of cardiothoracic because cardiothoracic more dealing with cardiac surgery. For the thoracic surgeon deals with chest or the surgical diseases of chest other than the pulmonologist. Like, for example, chest trauma, cases of lung diseases, like when some complicated infections happen, like lung abscess or some tumors of lung happens. So he will do surgery for that to whether to drain or to remove part of the lung. Also, once some fluids develop or air develop inside the chest cavity, making a compression on lung itself. Also, other things that thoracic surgeon or complications that or even diseases that thoracic surgeons deal with, the chest wall deformities like at pediatric age or adults, the tumors of the medium part of the chest, some rare issues like some thymus gland, which is like not common for people, and some more rare issues, such as people who have like palmar hyperhidrosis in their palms. So if they have like very severe situation that failed all the treatments given by their dermatologist, so thoracic surgeon can go by keyhole surgery to cut partially a small nerve in chest, which help those people to control their disease. Also, the airway disease, the surgical, like kids who might have aspiration of foreign bodies, or the tumors of the airway in adults group, and many others. So it's still like a tertiary service, not very well common to not only for laymen, even for some doctors.
Right. Now, Dr. Khaldoun, many times, you have children or infants with pieces of chalks or plastic pieces of toys that they have aspirated accidentally that get stuck in their chest cavity. Now, could you tell us how dangerous it is and how you deal with emergencies like this?
It's a real serious and dangerous situation, because what happens mostly, the child once starts crying, and some, whether like plastic pieces or even food like nuts or any other, lot of issues might be, or materials. So once they do that severe exhalation while crying and then try to aspirate or take deep breath, at that point there is high risk to get that material stuck into the airway, and it will block part of the lung, which make like sudden choking for the child, and ability to breathe properly. Even at some point, if it's a food, it might become wet in short period, and then like increase the size of the food, such as beans or the nuts, and then it will be blocking more the airway. Even in some situations, we saw that complete obstruction of part of the lung, and the two cases, unfortunately, baby become sure it become like, or it was a missed cases. Family didn't notice what happened, and they arrested, and they came like with, or they ended with the brain damage even. So in this situations, we go under general anesthesia after we confirm there is, because might sometimes not foreign body. Some people or some family will be like worried maybe something came into the airway, so we will do the needed radiology, and then we will go by endoscopy or bronchoscopy to take that material out to clear the airway. Even we notice that even in not only in the infants, even like with age 11, 12, they put, even at school, they keep whether like a needle or pen, a scarf, pen, or any other material, then start laughing for some reason, and then they might aspirate.
And that's what we've noticed as well, that it is extremely important for parents also to monitor when children are playing with small pieces as well. But also, you also mentioned about the lung health. Dr. Khaldoun, does smoking play a huge role in ruining the lung health? And what would be your message as a chest surgeon to them?
Yes, smoking plays a detrimental role in health of lungs and airway. It causes a chronic inflammation and irritation for the whole respiratory system, causing a destruction of lung tissue that leads to reduction in the lung function and the ability to tolerate the exercises. It increases the risk of lung diseases in general, as chronic obstructive pulmonary disease, called like COPD, common that term, emphysema of the lung, some chronic bronchitis. Also, it affects the immunity of respiratory system that leads to increased susceptibility to infections as pneumonia. So in general, it has no good effect. Sure, it's all are negative effects, but still, unfortunately, even some doctors smoking, so that by patients they will tell even doctors are smoking. So we should know what we do and try to avoid as much as we can, especially if we added some other issues, so that the environmental pollution, which exceed the negative effect of smoking.
Right, Dr. Khaldoun, a quick tip for everyone for good health of the chest cavity, how they can keep a good health of it?
Yeah, in general, incorporating special food in our diet can help actually to protect against lung-related diseases. This is a general thing, especially foods like saturated with antioxidants and anti-inflammatory, such as peppers, turmeric, ginger, pumpkin, peas, leafy greens, berries, a lot of veggies, apples, citrus, and also rich with omega-3 fatty acids like salmon, or even getting capsules, supplementary capsules of omega-3. Food also rich with unsaturated fats such as avocado. The vitamin D, it's important to maintain in body, because it has very important role in the body, in the bone health in general, like reps. Okay, and also it has regulating role in the body immunity. And sure, we should avoid the junk food, avoiding tobacco, reduce exposure to environmental pollution, whether at work, even at our apartment. Try to have a good, or well-ventilated place of living. Good quality of sleep in general is very important for our immunity to against any infections or any diseases. Controlling blood sugar. Some people, what's the rule? Yes, any uncontrolled blood sugar increase the risk of severe infections and even like surgical diseases to happen in chest. Having good posture at work, it's very important, because that helps to expand our lung capacities. Doing also the minimum at least of physical exercises, like 30 minutes 3 times per week, just to maintain our lungs or respiratory system health. So this is in general like in system health. So this is in general like in fast.
Superb, Dr. Khaldoun. I thought you will also say don't fall in love to maintain.
But thank you, Dr.
Other than your
Khaldoun.
wife, don't fall in love. Dr. Khaldoun, how can people get in touch with you? I'm sure there are a lot of questions which everyone has in mind right now.
My pleasure. Anytime I'm open for any questions.
And where do you consult? Where can people come and consult you?
Yeah, recently I'm at the Prime Hospital, Dubai, Al Garhood. So it would be a pleasure to help and support for any case related to chest or the surgical diseases of chest.
Super.
Thank you so much, doctor. Thank you.
Thank you and thanks. Have a nice day.
The Journal on Daybreak.